Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. A study recently conducted at the Mayo Clinic found that women who suffered from high blood pressure during pregnancy had a tendency to have more menopausal symptoms later in life, including hot flashes and night sweats. Here to discuss this with us today is Dr. Stephanie Faubion. Dr. Faubion is the Penny and Bill George Director for Mayo Clinic Center for Women's Health. Thanks for being here today, Dr. Faubion.
Oh, thanks so much for having me. I'm delighted to be here.
Well, this is really interesting to me to read about this. Could you tell us a little bit first about how you conducted the study?
This study was done based on the women that we see in our women's health clinic. It's called the Menopause and Women's Sexual Health Clinic in Rochester, Minnesota. And we also see patients actually in our Arizona location too. So this is more than one site that contributes to this large database called the DREAMS dataset. And it's the Data Registry on Experiences of Aging, Menopause, and Sexuality. So the whole data set is meant to inform us on what women go through during menopause and also their sexual health experiences. So this set came from women who have actually been seen in the clinic, and we collected over 2,000 women were in this study, and we looked to see those who had a history of high blood pressure during pregnancy. And I believe about 140 of the women that were seen during this period of time actually had such a history. So it was very interesting to see these results. There's only one other prior study that had even looked at this association before, and that was several years ago in a cardiology clinic of about 800 women. So this is by far the biggest study on this association.
If you could just tell our listeners one takeaway that you'd like them to remember from the study, what would it be?
One is that hot flashes and night sweats, we used to just think were a silly bother and nothing to really worry about. But more and more, we're starting to understand that these symptoms may be an indicator of women who are at higher risk for heart disease later. So they're not necessarily benign symptoms. And we're starting to learn that certain patterns of hot flashes are associated with higher risk. For instance, some studies in women's health have identified that those women who have hot flashes earlier, even before the last menstrual period, may be at higher risk for heart disease later. Not all studies show that same timing association, so there's more to learn there. But we know that it's probably not the hot flash itself that is the high risk for heart disease, but it just may be a marker for those women that have a higher risk. So that's one point. So menopause symptoms are not necessarily benign. We've known for a long time that high blood pressure during pregnancy is associated with high blood pressure after pregnancy and a higher risk of heart disease. So we've known that for a while, but we didn't know that these two things connected. What is still unclear, and what I hope this study can sort of lay the groundwork for, is determining whether a woman has one risk, or one of these, like high blood pressure during pregnancy, it might increase her risk a little bit, but we don't know if she has both of them, a high blood pressure during pregnancy and bad menopausal symptoms, if that risk is additive then. And so hopefully this study will inform some additional studies down the line that can help clarify that a bit more. In general, we really don't have good risk prediction models for women and heart disease. And so if we could make it a little more precise about which women are going to have a problem, then we can intervene earlier. So that, I think, is a takeaway. The third takeaway is that if we can predict which women are going to have a harder time in menopause, we can be better about educating them before they go into menopause. You know how women get the talk before they start their periods, and they get all this education, or I wouldn't say women, they're girls then. They get this education about what to expect and what to do. We do a terrible job of educating women who are about to stop their periods at the other end of their reproductive life. And guess what? They have just as many hormonal fluctuations and just as difficult a time. So if we could say, you know what, you're at risk for having a worse time during this phase of your life, and here's some things that you could do about it, Wouldn't that make things easier for women?
So I think preparation and knowing what to expect is so important and helps to decrease anxiety too.
Absolutely, it does. And if we could get at that a bit better for women, that is a life goal for me.
For all of us. Dr.
Indeed.
Faubion, do we know why there might be a link between high blood pressure in pregnancy and menopausal symptoms?
You know, I suspect they are just both markers of heart disease risk. And I think we're just seeing them connected because it's just a manifestation of that same risk. So I don't think that necessarily they are somehow causing each other. I think we're just finding them in the same women because they're both markers of that same risk. So I suspect that's what it is, but we don't know yet. And here's the interesting part. So we know that hormone therapy, for example, reduces hot flashes and night sweats and those symptoms that we were looking at in this trial. What we don't yet know is if giving hormone therapy will in some way alter that risk for women. So that's another unanswered question that we hope to have the answer for sometime in the future.
Did anything that you found in the study really surprise you in terms of results?
Well, there was one little odd thing, and that was these results were much more prominent in women who were on hormone therapy, and we didn't know why that would be, but we could theorize that it was the women on hormone therapy who were coming in our clinic who might have been having worse symptoms in the first place, and that's why they were taking hormone therapy, and perhaps we saw that association more in those women, but that is still unclear.
You mentioned earlier that some of the findings in the study may help providers to prepare women for going through menopause. Is there anything else, and are there other ways that this you can see this study helping with patient care or helping women to be able to ask the right questions of their providers?
You know, I think a couple of things. If women themselves would recognize that high blood pressure during a pregnancy puts them at increased risk for heart disease later, they can advocate for better screening. I think women tend to get lost between that time of that they have a pregnancy and deliver a baby, and then come around at midlife and nobody really asks about what happened during a pregnancy to assess their risk. So I think if women can really say, you know what, I had this thing back when I had a baby, does that mean something for me? So if women can advocate for themselves, it would be great. Same thing with regard to menopause symptoms. I think so often we tend to blow those off for women, and I think women need to be self-advocates here and say, I am not having a good time. I am having trouble functioning. I can't sleep. My mood is terrible. I'm hot flashing all the time. I can't focus. You know, if that's happening to you, there are treatments out there. There are things that we can do. And we shouldn't just be sort of patting women on the head and saying it'll all be over soon, because guess what? The mean duration of these symptoms we now know is 7 to 9 years. So it's not exactly a short time. So the message here is that women can be better self-advocates.
If a woman does have high blood pressure during pregnancy, should she be more concerned than perhaps other women are about the risk of cardiovascular disease? And is there anything that she can do to help mitigate or reduce that risk?
Absolutely, yes, she is at higher risk of heart disease later, and she should be looking at other things that she can control. So if she smokes, she should stop. She should look at her weight, her lifestyle. Is she exercising? Is she sleeping? Is she managing stress? But also knowing her numbers, like her blood pressure, her cholesterol, her blood sugar. So those risk factors that we already know are risk factors for heart disease for men and women, we should be looking really closely at those for women with a history of high blood pressure during pregnancy.
What are the best things that a woman can do to help decrease the symptoms of menopause?
Oh, well, that's an hour lecture right there. Well, there are a few things that women can do on their own. Unfortunately, most of the over-the-counter things don't work. So it's not like I can recommend you go out to the drugstore and grab an herbal supplement and things will all get better, because unfortunately that's not true. Exercise, unfortunately, has not been shown to help with hot flashes. It helps with just about everything else, but not with hot flashes. There's some evidence suggesting that weight loss might help a little bit, But beyond that, I would say if your symptoms are really bothersome, you need to engage the help of your medical provider. And there are plenty of things that your medical provider can offer. Hormone therapy is the most effective. It's not right for every person, but is the most effective treatment for reducing hot flashes and night sweats. There are some other prescription non-hormonal treatments available as well. And there's some new things in the pipeline that are really exciting that are also non-hormonal that may be out soon. So lots of options out there.
That's great. This has been really fascinating to me. I wasn't aware of this. Like you said, we tend to sort of just brush those off, that, oh, those symptoms, whatever, that just happens to people, and not focus on it too much. So I don't think I've thought much about this since medical school. but obviously we're all approaching this at some point in life. So good information.
Well, thank you.
Our thanks to Dr. Stephanie Faubion, Director for Mayo Clinic Women's Health. We hope you learned something and that you have a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.